Dr. Tom Roselle live right now, 630 WMAL.
You're listening to Dr. Tom Roselle live. I'm at 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject you have in mind. Talking about some interesting tidbits and facts today, things that will only make a difference in your life. Something called sulforaphane glucosinolates. Now, what's that? Well, guess what? I'll tell you where it's found. It's found in broccoli sprouts. It's a rich source of that substance, and it's been associated with a dramatically decreased rate of tumor formation and growth of cancer in different animals that they've tested it on. What does that mean to you? Well, the studies are in, and it seems to be, and a lot of the studies were done as early as 1992 at Johns Hopkins University, and they're finding that the application, over 500 different studies, is all in and says, guess your cancer can be reversed and your cancer can be prevented in many situations, not all of them. There were some interesting trials, and also the effect on cardiovascular disease and airway inflammation, and also things that are causing vascular bed degeneration. So here's the deal. Broccoli is good for you, okay? Bottom line, some of you don't like broccoli, but broccoli is good for you, but particularly when it's not cooked. There's some mitigation of broccoli in its effect, and the substance of sulforaphane, and you need to eat it raw. So how do you get it? Well, broccoli sprouts. See, when you get your salad, and if you put broccoli sprouts on it, you get high levels of the substance, and so subsequently you can make some huge shifts and huge changes in your body. Heating broccoli partially degenerates and inactivates this product, and in the gut of healthy people, the metabolism is slowed down, and it doesn't work like straight broccoli sprouts or seed extracts that are taken orally. So there's substances out there, there are nutritional products that you can take, and just be very, very careful of the ones that you pick. But it's quite significant. The response is amazing in how it reduces inflammatory levels within the body, and then subsequently tumor inhibition. What they also found is that it has a very profound effect on metabolic syndrome. Metabolic syndrome is when you start seeing the increased levels of blood fats, particularly cholesterol, increased levels of blood pressure, increased levels of blood sugar. Now, it doesn't have to be outside normal limits. They just start rising together. The reason that happens is because the normal transportation for metabolism is being depleted or altered or impaired in some way because of inflammation. So inflammatory response in the body has to be controlled. This is a way to control inflammatory levels within the system. It's amazing relative to the research that's putting out there that it actually makes a huge, huge difference. They've done the studies with cardiovascular patients and patients who have high blood pressure, patients who've had intestinal tract infections, particularly Helicobacter, and rheumatoid arthritis patients, and airway obstruction patients, and so forth. And across the board, even with neurological conditions, it works. The one that really interests me is the study that they did with patients who have macular degeneration. And it showed that in these patients that there was an effect where many other nutrient-based products had no effect whatsoever. Now, does it happen across the board? I'm one of these guys that's going to tell you that nothing works always, that it has to be very specific. It should be, if you want to enhance the process, you have to use other things as well. You want to maximize your wellness potential as best as you possibly can. Safety, side effects of the things, there's studies that have been conducted to assess the safety of this in humans, and they're randomized, they're placebo-controlled, double-blind studies, and it showed that broccoli sprouts extracts were without any significant side effect whatsoever. Doses in the neighborhood of 20 to 100 millimoles of the substance for 7 days showed nothing. And then they did other double-blind studies, and it comes down to that there is really no side effect whatsoever. They applied it to skin surfaces. They applied it every way they could possibly apply it. And they did it in Petri dishes. They did straight up. And it's just a good thing. So here's the deal that, broccoli and broccoli sprouts and broccoli seeds have a great safety profile, with no known contraindications with any type of medication or drug. Isn't that great? So you can go out and eat your broccoli. Make sure you get broccoli sprouts and broccoli seeds and put them in your diet and add it as one of the pieces that will enhance your overall wellness index. See, something so simple. And if you take your multiple vitamins, you take a good one, and you eat your broccoli, life can be a whole lot better. And my job is to make your life better and to increase your wellness index as best as I possibly can. Want to remind you again, Ageless Health 2011 is coming up in September. Go to our website, rosellecare.com, and begin to check out the information and register early because there will be no discounts late in the game. You have to do it early on. Those of you who have attended will be getting a mailer from us shortly with a very, very special invitation and registration. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. I'm at 888-630-9625. That's 888-630-WMAL. Love to talk to you. Any subject that you have in mind. Perhaps you've had a problem, you've tried, you applied. Guess what? Let's really fix it. Let's give you a direction that may work, and let's see if you're willing to step up to the plate to get it done. Thermography Centers of Fairfax, an ongoing sponsor of Dr. Tom Roselle Live. Many of you have taken advantage and have found it extremely invaluable. Well, let me tell you something. Ladies, those of you who've had mammographic examinations, what you don't know is this. If you've had 4 to 5 mammograms in a row, you've increased your risk of breast cancer by 40%. That's right. You've increased your risk by 40%. Think about it. Your breast tissue is put into a vise, it's crushed, and then it's irradiated. You increase the damage to the cellular tissue, subsequently starting the response of cellular breakdown and then cancer. Thermographic imaging does not have the 20% failure rate that mammography does. Matter of fact, one of our patients who had just recently had a mammography went in and had a thermography done, and the thermograph found a high level of suspicion in a heat signal that was coming from the upper quadrant of the breast. And she went back to her physician. Physician said, well, this is garbage. She said, there's no merit with that, and your mammography was normal. Well, we encouraged her to go to another physician, and that physician sent her out for an MRI and an ultrasound and so forth, and subsequently came back with a positive finding. As far as I'm concerned, thermographic imaging is one of the most important and most valuable tools that you can add to your annual health laboratory procedures. It should be something that all of us should do. Give Dareth Painter a call at Thermography Centers of Fairfax. It's 703-943-7248. That's 703-943-7248. Promised you we'd talk a little bit more about vitamin D, and the data keeps coming in. We've been talking about D for years and years, using it with our patients and telling them that they're totally inadequate. Years ago it says 400 units of vitamin D was all that was necessary to do what it needed to do. Well, we've said that's garbage. Well, it protects you from all kinds of chronic diseases such as cancer and diabetes and heart disease and so forth, and it's really one of the most important things you do. But here's things that you really need to know about it. A study that was done by British researchers, it was performed just recently, and what they did is they broke people into groups. There was 28 studies that were done, and they involved 100,000 men and women. So this is not a small study. This is significant. And those with the highest levels of vitamin D, serum levels, blood levels of vitamin D, had 33% less risk of heart disease, 55% less likely to develop diabetes, 51% less likely to develop any kind of metabolic syndrome problem. Remember we just talked about high blood pressure, high blood sugar levels, and so forth. So it's significant. This is not something that can be poo-pooed or your doctor said, well, you don't need the vitamin D. Well, you do need it. Italian researchers collected information on serum vitamin levels of 1,000 patients over the age of 65 years old, and they followed their health outcomes for an average of 6.5 years. And those with the lowest levels of vitamin D were at dramatically increased risk of dying from cardiovascular disease or other illnesses. See, we don't get outside, and we don't eat fish, and we don't eat the things that we need to have in our body. Most people don't spend the amount of time outside to get well, to get healthy, to feel good. And then when we do, we put sunscreens on, which blocks the vitamin D. Say, well, I go outside. Well, no, you don't if you put sunscreen on. It's like staying inside. Supplementation is even much more important in that type of condition. In general, the only people that really have to worry about vitamin D, this goes back to some of the things that you're reading now in the papers, say, well, vitamin D can cause problems. Well, it only can cause problems generally in people who have tumors of the parathyroid gland, things called granulomatosis diseases, lymphomas, sarcoidosis, and tuberculosis. The reason for that is that those conditions all by themselves produce too much vitamin D. So what you do, if you're adding vitamin D with somebody who's producing vitamin D, you increase your risk of an elevated calcium in the bloodstream and subsequently plaquing and damaged organ systems and so forth. But without vitamin D, you have a problem. Many of you read a newsletter by a cardiologist by the name of Stephen Sinatra, and he recommends that we should be at a minimum of 2,000 units a day for people who are totally healthy and have adequate levels of vitamin D, 5,000 units for people who have health concerns and not really doing well, and 10,000 units a day every day for people who are not well. That's significant. That flies in the face of traditional medicine. So you really need to know what your levels are. And you've heard me say 100 times that vitamin D levels under 50 are considered insufficient. Vitamin D levels under 32 are highly deficient. So you need to know what your number is. You need to get your doctor to order the test. And then you don't want a vitamin D2 supplementation. It doesn't work. Vitamin D3 from a natural source is what you want to get. Those of you who are not our patients and so forth, go to the health food store. There's one company that I'll recommend as having stood the test of time as Carlson Vitamins, and I don't usually recommend any company simply because they don't pay for Dr. Tom Roselle Live, but never having said that, Carlson is a excellent company when it comes to vitamin D. You got to be taking it. You have to get this in as part of your daily regime. If you do that, and you know what your vitamin D number is, if you have a very low number, you have to take much more of it. If you have a number that's adequate, then you have to maintain it. But very few of you, and what our experience is in this area, generally 75% or more of you are vitamin D minimally insufficient and very deficient. What's the number that you're shooting for? 65 to 80 is where you want to be. Once you hit 65 to 80, closer to that 80 mark, that's where good immune system kicks in. You get around that 50 mark, 55 mark, and then you really stop worrying about fractures and bone demand of vitamin D. But you want to get it up there. You want to scoot it up to a higher level. It's important. This is one thing along with vitamin K is they're not to be overlooked. It all starts with diet. Obviously, if you can get outside in the summertime, around this area from about September 1st to the first part of May 1, you get no vitamin D from the sun because it's on such an angle that it doesn't stimulate the receptor sites. And if you're covered up anyway when you're outside, or you're wearing sunblock, you're not getting anything anyhow. So check it out. Find out what your vitamin D levels are. If you really want to see healthcare costs go way down, that's one important step. You add that to the fact that walking 2 miles a day, just 2 miles every day, get out and go for a walk every day, 7 days a week, decreases your risk of dying from any disease by 50%. And then you increase your water. Wow. I mean, that's simple stuff. There's not a whole lot of brain power going into those things. Get it done. Do it now. 888-630-9625. That's 888-630-WMAL.